Do you get back pains when you're sitting down but you don't have it when you're standing up? Now, this is very common. A lot of people I know, a lot of our patients who comes to the clinic, they will complain of back pain when they're sitting down. And then to relieve that pain, they get up, they walk around. So if you're feeling this, if you're having pains on your lower back when you're sitting down, let's say watching TV or eating dinner, and when you get up, you relieve the pain, or when you walk around, you relieve the pain, then I want you to watch this video. Make sure you watch it till the end, because I'll be showing you 3 top exercises that I give to my patients how to relieve this back pain when you have those symptoms. Hi, this is Reggie from Restore Plus Physical Therapy, and welcome to today's tip of the day. Now, if you're having pains like that, one of the things that might be causing that pain is a slip disc, or in medical terms, it's a herniated disc. This is very common nowadays because we sit a lot for work. We work on the computer most of the time, especially now, a lot of people working from home, or when you're resting, watching TV, or also when you're scrolling through your cell phone, you're going on social media, watching YouTube. This is very commonly done, that we're all sitting in those positions. So technology has its pros, but this is one of the cons that we have with modern technology, because we sit down more often than not. So what happens? Why do you have that back pain when you're sitting down, and why does it go away when you're standing up? Now, let me give you a brief idea on what's happening on your spine when you're sitting and when you're standing, and you'll understand why you're having the pain when you're sitting, and then why the standing or walking relieve the pain. So the first thing is, what does the spine look like? So your spine is one section on top of the other. So you have bone on top of the other, right? So now between 2 sections there is a gap, and in that gap you will have a disc. The disc is a gel. It serves as a cushion. It's a shock absorber. So the bone, because of gravity, is not going to be touching the other bone. So now they're separated by that disc. And what happens is, when you're sitting down, most of the time when you're sitting down, I see very few people that they're sitting up straight. So most of the time when you're sitting, you're slouching. And when you slouch like this, what happens is your spine will curve this way, and when your spine curves this way, you see there's more space back here, right? So, and there's less space here. So imagine there's an object there, there's a gel there. So when you, instead of being straight like this, when you go this way, what happens? The increase in space at the back makes that disc more prone to coming out towards the back. And not only that, when you have the bone towards the front, kind of pushing it this way, so it's like pushing it this way, so what happens is, it will make your disc more prone to pushing out to the back, which is what we call a herniated disc. Most of the time, the disc will herniate towards the back because of the way that position is, and also there's less structures at the back that's preventing it from coming out. So that is why you will have a slip disc, because when you're sitting too much. Well, there are other factors there are other reasons that can be causing that, but that's one of the most common reasons, and that's one of the leading reasons why, because of the sitting too long. What happens is, when your disc slips to the back or herniates to the back, it will press on either the spinal nerves, or it can even press on the spinal cord. Now, the nerves are very sensitive structures, so light pressure on them can cause symptoms, and your symptoms can include pain, can include tingling, numbness, weakness, or a combination of all of those. So when the disc slips to the back and it touches those nerves, you're gonna have those symptoms, and we're going to address those symptoms. That's why it's important for you to follow these exercises. Watch this video to the end, because I'm going to show you the 3 exercises that I recommend to my patients, at least to start off, to relieve that pressure on the nerve and get rid of those symptoms. So let's jump right into it. The first exercise that I'm going to show you is called prone on elbows. So prone means going on your stomach. So you're going to go on your stomach, and you're going to prop up on your elbow. So what it will do is, it will gently push that disc back a little bit and relieve some pressure off of those nerves. So let me show you. So you're gonna this ideally, I want you to do it on the floor or on a very firm surface. If your mattress on your bed is very soft, I don't recommend using your bed. You have to do it on a very firm surface, meaning very firm mattress, or ideally, I recommend doing it on the floor. So you're going to go on your stomach like this, And then I want your elbow next to your body like this, your hands next to your face. And what you're going to do is you're going to prop up on your elbow. So bring your elbows underneath your chest. So come up like this, and I want you to hold it for 10 seconds. After you reach 10 seconds, I want you to go down. And when you go down, you come back up. Hold it for 10 seconds again. You want to cycle through this. You want to do it 5 to 10 repetitions, holding it 10 seconds each. Now, each time that you come up, what you want to do is you want to just relax. Make sure you don't lift your belly up like this. Just relax and let your belly drop. Let your back have that curve. Okay? So you want to go like this. Try to relax. Now, if you do this and you're having a little bit of pain, that's okay. That's acceptable. If you do this and you have a lot of pain, I want you to stop. You don't want to have too much pain. Little bit is okay. And as you keep repeating it, what you want to feel is you want to feel that the pain is going away. Or ideally, when you actually prop up like this, ideally, you want that pain to get relief even in the first couple of repetitions. Remember, if the pain increases or pain is too much, you have to stop this exercise. When the first exercise feels comfortable, I want you to progress it now. I want you to do the second exercise, is what we call prone on hands or prone press-ups. Prone meaning, again, you're going to be on your stomach and then you're going to press up your body. You're going to push up, but it's not doing a push-up like a traditional push-up that you do for strengthening. Let me show you. So you're going to go on your stomach, again, on a firm surface. I recommend going on the floor. So put your hands next to your chest. And then what you want to do is you want to come up this way. So you're not doing a traditional push-up that you're actually doing this. No. You want your belly, you want to drop your belly. So your belly, if you can stay on the bed and just push up. And some people call it the Sphinx position. It's because it looks like you're going on the Sphinx. You go this way, watch your neck. You don't want to overextend it, then you're going to have neck pains. So just look straight and then hold it for 10 seconds. Then you go down and then you come up again. Hold it for 10 seconds and then you go down. So you're going to repeat that cycle. Again, like the first exercise, what you're looking for is when you do that, the first couple, you want to get that pain to start going down. If not, a little bit of pain, it's okay. But if the pain increases a lot, you start having severe pain, you have to stop this exercise. Sometimes you're able to do the first one, the prone on elbows, but when you progress to the prone on hands, you can't do it. If that's the case, don't push it. Go only as high as you can, or maybe do that the next time. That's why it's called the progression. You may not be ready for it. As long as you have little pain, you're okay. No pain is the best. A lot of pain, you have to stop this exercise. Now, the third exercise is a standing extension. So if the first two exercises are tolerable for you or you felt relief with those, then you progress to the third exercise. So the third one is you're going to be standing, and then you want to put your hands either on your buttock area or in the hip area here, and then you want to extend going backwards. So only go as far back as you can. If this feels more comfortable, go as far back as you can. Hold it for 10 seconds. And then you repeat. So for me, I'm putting my hands here. It just feels more comfortable for me. So you can do the same thing. So you're going this way. Just watch your neck. Don't hyperextend your neck and make sure you don't strain it. So you just want to go back, relax your neck, or just neutral. Hold for 10 seconds. And then you come back. You do that 10 repetitions or 5 repetitions. You start feeling relief. Great. If you start feeling increase in pain, especially if it's sharp pain, a lot of pain, severe pain, then you have to stop doing these exercises. There you have it. Those are the top 3 exercises that I recommend for my patients with slip disc or herniated disc. Now, usually the symptoms are you have pain during sitting and it gets relieved by standing or walking. So when you have those symptoms, the one that is painful when you're sitting and then gets relieved by standing and walking, these are great exercises for you. They're nothing crazy, they're not too technical, they're very simple. I like exercises like that for my patients, especially to start off. Simplicity and basically commitment, consistency and commitment. Those are very important, because if not, then you won't be able to relieve your symptoms or you won't recover from your injury. Thank you very much for your time for watching this video. I hope this is helpful to you, especially if you have back pains. I hope this is something that you can try and it will help you relieve of your pains or any of those symptoms. And please don't forget to share this with your loved ones, especially if they have back pains, because this is something that I recommend to all my patients. This is something I prescribe to all my patients, and this is something that I know will be helpful for them also. And don't forget to click on that subscribe button and turn on your notification so that you can get alerted once our new video comes out next week, sharing more tips on how you can get healthy and pain-free. Now go watch the next video.